For more than 2,000 years, the single most common medical treatment on the entire planet was to deliberately cut a patient open and drain out their blood. Not for one specific illness, but for almost all of them. A fever? Bleed them. A headache? Bleed them. Pneumonia, madness, a broken heart? Reach for the blade. And here is the grim truth we now understand. This treatment, the crown jewel of medicine for 2,000 years, probably killed far more people than it ever saved. It drained the strength from the very patients who needed it most. And this was the best that medicine had to offer. So how did anyone survive getting sick at all in a world that had no real idea what sickness even was? Because that is where we have to begin. For almost the entire history of our species, nobody knew what actually made you ill. There were no germs, because nobody knew germs existed. When a fever swept through and took a child, the cause was a complete mystery. Maybe it was bad air rising off a swamp. Maybe the fluids inside your body had fallen out of balance. Maybe a god was angry, or a neighbor had cursed you. And because nobody knew the real enemy, almost every treatment was a shot in the dark, and a great many of those shots hit the patient. But here is the twist that changes the whole story. Through all of it, there really was a doctor on the case. It just wasn't the one holding the blade. It was inside you the entire time, an ancient, extraordinary war machine we call the immune system. And for almost all of human history, it was doing nearly all of the actual saving. Think about what your body does the instant something invades it. It has an entire army it can send in. Cells that hunt down and swallow invaders whole. That fever you hate so much is not the illness attacking you. It is very often your own body deliberately turning up the heat to cook the invaders and speed up your defenses. The aches, the swelling, the exhaustion that pins you to your bed, so much of it is not the disease at all. It is the war being fought inside you, and the exhaustion is your body forcing you to rest and pour everything into that fight. This system is hundreds of millions of years old, refined over countless generations, and it is staggeringly good at its job. For our ancestors, when they got sick and then recovered, the overwhelming reason was not the healer. It was this. So the real question is not how ancient medicine cured people, because mostly it did not. The question is what our ancestors did while their own bodies fought for their lives. And the first and most important thing they did is the one we most overlook. They cared for each other. When you are burning with fever, someone bringing you water so you do not dry out, keeping you warm, feeding you a little food, and simply staying at your side. That is not nothing. That is often the difference between living and dying. A sick person alone in the cold with no water, these of things that a cared-for person easily survives. For most of history, the most powerful medicine on Earth was not a potion at all. It was another human being sitting with you, keeping you alive long enough for your immune system to finish the job. The second thing they did was reach for the world around them, and here our ancestors were far cleverer than we tend to give them credit for. Buried inside thousands of years of trial and error was a genuine pharmacy of things that truly work. They chewed willow bark to bring down a fever, the same chemical we later turned into aspirin. In South America, people used the bark of a certain tree against the violent chills of malaria, and it held quinine, a real cure we still use today. In ancient China, healers treated fevers with a plant called sweet wormwood. And thousands of years later, scientists pulled a powerful anti-malarial drug straight out of it. They packed wounds with honey, which genuinely kills bacteria. These were not lucky guesses. This was a hard-won library of real medicine, discovered the only way they could, by watching, remembering, and passing it down. And some of what worked sounds, frankly, insane. Ancient healers would lay slices of moldy bread onto infected wounds. It sounds like a wonderful way to die. But certain molds produced natural antibiotics, the very same family of compounds we would one day purify into penicillin. They were, entirely by accident, applying an antibiotic thousands of years too early. Stranger still, they placed live maggots onto rotting flesh. And once again, it worked, because the maggots eat away only the dead and infected tissue and leave the healthy flesh clean behind them. A technique so effective that hospitals still use it today. Our ancestors could not possibly have known why any of this worked, but they saw that it did, and they kept on doing it. But here is the tragedy sitting at the very center of all of this. Because nobody understood the true cause of disease, the genuinely useful remedies were buried in a mountain of ones that did nothing, and ones that were actively lethal. The same healer who knew the honey trick might also drain your blood, dose you with poisonous mercury, feed you crushed animal dung, or hang a useless charm around your neck. And there was no way to tell which was which. With no real understanding, and no way to properly test a treatment, a deadly idea like bloodletting could survive for 2,000 years, sitting right beside the honey that actually healed. Good medicine and terrible medicine looked exactly the same from the inside. That, more than anything, is why going to a healer was so often a gamble. There was one instinct, though, that our ancestors got exactly right, long before they could possibly explain it. They noticed that sickness could pass from one person to another. And so, again and again, all over the world, they separated the sick from the healthy. They sent people with visible disease to live apart. During the Great Plagues, cities would seal off arriving ships and force them to wait, isolated, for 40 days, a practice that handed us the very word quarantine. They had no concept of a germ, but they had seen, with their own eyes, that keeping the sick away from the well saved lives. It was a brilliant piece of pure observation, centuries ahead of the science that would one day explain it. And they needed every scrap of it because when something genuinely new arrived, all of it could fail at once. When the Black Death swept across the world, it killed a third, and in some places half, of everyone it reached. The immune system, the honey, the nursing, the quarantines, against a brand new horror on that scale, none of it was enough. These were the moments that revealed just how fragile the whole thing really was. Getting sick was never only a private misfortune. It was in the end the single thing most likely to decide how and when you died. And yet, even against this, our ancestors made one last astonishing leap. People noticed something strange about certain diseases, like smallpox. If you caught it and survived, you never caught it again. Somehow, your body remembered. So, in a genuinely daring move, they began deliberately giving healthy people a tiny, controlled dose of the disease, hoping they would suffer only a mild case and come out the other side immune. It was frightening and it was risky, but it often worked, and it was done in China, in India, and beyond, long before anyone understood immunity at all. By raw observation alone, they had stumbled onto the single most powerful idea in the history of medicine, the one that would eventually grow into the vaccine. So what did ancient humans do when they got sick? The honest answer is that they did their best in the dark. They comforted one another. They reached for the plants that worked, and tragically, the ones that did not. They separated the sick. They endured the plagues, and above all, they waited and hoped and trusted a body they did not understand to fight a war they could not see. For hundreds of thousands of years, getting better was mostly not something medicine did to you. It was something your own ancient biology did for you, while the people who loved you kept you alive long enough for it to work. And then, astonishingly recently, the lights came on. A little over 150 years ago, a handful of scientists finally proved that the true cause of so much disease was tiny living things, far too small to see. For the first time in the entire human story, we could finally see the enemy. And everything changed, faster than at any point that came before. We learned to wash our hands, and mothers stopped dying in childbirth. We learned to sterilize, and surgery stopped being a death sentence. We found antibiotics, and infections that had killed for all of history became a few days of pills. We built vaccines that wiped out diseases which had haunted us for thousands of years. In the blink of an eye, the coin flip stopped being a coin flip, which brings it back to you. That infection you clear with a cheap course of antibiotics, the childhood diseases you will now simply never catch, the fever you barely spare a thought for, all of it would have been a genuine gamble with your life for every single ancestor you have ever had. You belong to the first tiny group of humans in the whole story of our kind who actually know what the enemy is and can kill it. But do not forget the older hero in this story. Every time you shrug off a cold, that ancient war machine is still there inside you, still doing exactly what it did for every ancestor who ever survived long enough to pass life on to you. It carried our entire species through the dark for hundreds of thousands of years, waiting for us to finally learn how to help it. If you made it this far, you're exactly the kind of person I make these for. Subscribe, and we'll go find the next strange thing together. For almost all of human history, medicine could not save you. Your own body did that, quietly, from the inside. And the best that a healer could really do was sit beside you and keep you alive long enough to win.